There is one thing that makes these conversations a lot easier, and that is caffeine. And there is a coffee and refreshments bar out here in the lobby area, and we have a very important person to thank for that, our coffee sponsor, Navrev. And so I would love if we could give a warm welcome to the CEO of Navrev, Rashi Romanoff, to share a few words with us. And we'll try not to knock you over with this wall as it moves off, so awesome. Thank you, Rashi.
Thank you. Well, the good thing about sponsoring or partnering to provide coffee hopefully means that everyone's energized. It's the beginning of the day. I have to say, because it's Halloween, I had a very long conversation this morning with my 3-year-old who tried to convince me to also wear a Moana costume to do this speech, which it was a compelling argument, but I thought I'd play it safe since I'm new in my role at Navrev. But welcome to DC, welcome to IEX. My name is Rashi Romanoff. I am the new CEO of Navrev, or the National Association for Veterans Research and Education Missions, which I think rivals for maybe longest name of an organization. But I'm no stranger to the innovation community or to the VA. I worked in this community right out of grad school. I worked at the VA, actually shared Cube space when I was at the partnerships office with the innovation team when they were just thinking about sort of the early origins of IEX. So it's great to be back and great to see how this event has transformed, and really just excited to now support it on the outside at Navrev. So what is Navrev? I'm not going to ask people to raise their hands if they've heard of it because I have a sense I know the answer to that. The way I've been describing it over the last couple months since I joined is that it is the most interesting and fascinating organization that you've probably never heard of. A quick history lesson is that 30 years ago, Congress teamed up with the VA to design an infrastructure that would ensure that veterans have premier access to cutting-edge treatments. So if there is a miracle cancer drug in a phase 2 trial, we want to make sure that there's a way that veterans can access that first in line if they want. However, complicated appropriations law means that entities like the NIH or DoD or even Pfizer, Johnson & Johnson can't just give money to the VA for clinical research. So Congress authorized the creation of all of these local VA-affiliated nonprofits and foundations that work with external funders to advance the research mission of the VA. Fast forward 30 years, we now have more than 75 VA-affiliated foundations and nonprofits across the country, which in FY22 alone brought in more than $300 million worth of investments to further research and education missions of the VA. And Navrev and myself, I'm humbled to represent these 75 organizations. So we're a membership organization representing this nonprofit. So you might be asking, so what's the connective thread? Why are we here today? Why are we at IEX? Over time, this infrastructure of the nonprofits has adapted to meet VA's needs. So for example, we were initially focused on clinical research. In the 90s, Congress said this should also really include things like education. So they amended and they said now these nonprofits can work with external partners to educate VA staff, to educate veterans, and even their family members, if you can believe it. So there's a rich tradition of the nonprofits in Navrev adapting to meet VA's needs, which I think is critical for the folks gathered here today. Because we know that the way that healthcare is being delivered is rapidly, rapidly changing. And the fact that you're in this room and you registered and you traveled to be here means that you all believe in the power of the VA to be a leader in the transformation of how public health is delivered for all Americans. And I'm here because I'm inspired by the power of what if. What if it was easier for VA to partner with external organizations and improve care delivery for veterans locally? What if VA staff could identify priority areas of interest and work with external organizations to improve care? And finally, what if we could leverage this exact same infrastructure that has facilitated and coordinated clinical research for decades across the VA to support innovation and quality improvement across the VA? By definition, Navrev was designed to be flexible. It was designed to meet VA's needs. And my belief, and what I'm excited to do in my new role as CEO, is to think about ways we can adapt this model to support innovators across the VA to bring more pilots to the VA system. And if you're interested in helping us learn more, feel free to email me. I'm in the app, rashi@navref.org, or reach out to anybody at our team. In closing, what I'll just say is, I've worked inside the VA and outside the VA, and I know it can be tough, and I know the work isn't always easy, and it can be a challenge. But VA has also made significant advancements in their ability to facilitate clinical research and in their ability to work with partners to improve care. And in my new role, I am so excited to help. What I'd like to leave you with is a small challenge. So I talked to you a little bit about my what ifs. And so what I'd like to challenge all of you over the next few weeks is to challenge the limits of what's possible and to find your own what if, and maybe find some friends along the way who can help you answer that question. Thank you so much, and enjoy the next few days.